See, this is the current scenario. You know, there are 26 crore people taking tobacco, and you're finding people taking tobacco everywhere, all around, है ना? हर जगह जगह मिल रहे हैं. And if you are a clinician, adult clinician, मतलब you're dealing with adult patients, not a pediatrician, you will get almost 60% or 70% of the patients you will come to you are having some tobacco use. Am I right? But tobacco users will visit hospital more than the non-tobacco users. Okay? So there is the current scenario. They need help. I want to quit, but there is a need a tobacco cessation specialist, and that is what is required. We need to have more and more numbers of tobacco cessation specialists everywhere. Okay? A world where a trained tobacco cessation specialist is available to every patient. Like Madam has said, why means till now, if a person, what is happening, the biggest problem right now is the lack of tobacco cessation specialist, and the bigger lack is the lack of knowledge by the treating or a clinician in the, he may be a neurosurgeon, he may be an oncosurgeon, he may be a neurologist, cardiologist. They have lack of knowledge about tobaccos, how to help a person to quit tobacco. So what they do is, but they also have a ego problem because they cannot tell that yes, look, I have a lack of knowledge, so I need to have more knowledge, but they would go ahead and treat the patient as if they know them, they have the knowledge. This is the biggest problem that we are facing right now. A person who visits a neurosurgeon will not, if the person asks, if the patient asks to the neurosurgeon, ki mere ko tobacco chhodna, because the patient had a stroke, now he wants to quit tobacco. The neurosurgeon will never think of referring the patient, but he will give him a guideline, whatever he thinks is right, even if he is lacking the knowledge. And this is the biggest problem in India, right? But with the presence of tobacco cessation specialists at every place, everywhere, and if a person is getting good response, good treatment, then definitely the confidence level of the referring doctor, the confidence level of the patient, and more importantly, the confidence level of the treating doctor, the treating cessation specialist will improve.
Why do doctors fail in helping people quit tobacco? Skill gap. That's what we are doing today, all of us together. All right. Ownership. So ownership will only come when you actually have a tobacco cessation center. You have to set up one. You can't do it separately. You have to set up a tobacco cessation center. The patient has to know that this is a separate problem. He doesn't come to a dental surgeon and say, correct my diabetes. No. He goes to a diabetologist. So he doesn't sit in your cancer care center and says, okay, my tobacco, please look after my tobacco. The tobacco cessation center has to be set up. It has to be set up, whether it's in your clinic, in a separate room, in a separate section, and on a separate day when you draw out, roller down things and your posters change and the look of your room changes, or you have a separate workspace where you are actually putting it down. Then doctors themselves using tobacco. So when the patient sees the doctors using the tobacco, they don't want to believe that this product is harmful. They say the doctor is using it. How the hell can it be harmful? So remember that doctor's survey, which we sent out to all of you right in the very beginning, how important it is. What is the role of all of us giving up that use of that product, if any one of us are using, if you actually want to be a tobacco cessation specialist, because you are not going to send out the message correctly. So most of the people only give a prescription, but you can see that the tobacco cessation wellness is much more than a prescription. There is first an assessment, and this assessment is dynamic. It is changing from time to time, time of the day to day, month on month. So the assessment goes on in a very dynamic process. There are many social factors. We saw Sonia that day. We saw other things and how we can bring around and change things. So important to remember that we have to have in the patient's mind also, and the role model has to be created.